everybody. Welcome. Thank you for coming. It's been a long day, and I don't think that I've heard much about Trump until now. So somebody had to do it, and we're going to do it on this panel. We're going to talk about Trump and the radical changes to global health policy from the United States and its impact beyond the United States. My name's Susan Ferriss, and I'm an editor at the Pulitzer Center. We support journalism. Some of you know us, and if you want to stop by the booth to talk later, you're welcome to do that. I'm going to introduce our speakers. First, we have Taiwo Adebulu. He is from Nigeria, and he's the features and investigative editor for The Cable. He's done a lot of reporting, yes, he's done a lot of great reporting on challenges, healthcare challenges in Nigeria, failures, successes. He's looked at USAID cuts in Nigeria. That's the U.S. Agency for International Development, which Trump basically shut down when he started in January. This was a savings move, but it's actually, their budget was 0.03% of federal spending. And next, we're going to have, down at the end, Molly Knight Raskin. She's a reporter and producer. She has done lots of reporting on global health. She is in the United States, and she recently worked on a series about USAID cuts and the impact on families in Africa, a couple of countries in Africa, and it was part of a series called Cuts and Consequences. And this was aimed at, it was aired by PBS, public television in the United States, the NewsHour, an excellent show, Cuts and Consequences, for Americans to learn what's happening now. And next, Jeff Kahn. He is a professor at Johns Hopkins University. He's an expert in global health, policy, and bioethics and ethics of medicine. He's the Andreas Drakopoulos director of the Berman Institute of Bioethics. And he's thought deeply about the implications of these cuts and how, along with this, many investments and testing, trials of drugs were halted abruptly, and there are very huge ethical implications of this. So I think we're going to get the slide, and we'll start off with Taiwo. Wait, don't
okay.
Push the black one.
Now, I title my presentation, Pre-Trump Order, a Visual Retrospective. Now, in this presentation, I'm going to give you a kind of visual presentation of the situation of things before the Trump order came in. I mean the order that ended the USAID. And it's going to give you a kind of clue on the impact of this particular order on global health, especially in developing countries. Now, I'm going to tell you the problem at hand. So you need a bit of data to understand what actually was in place before the order came into effect. First of all, Nigeria is Africa's most populous country, and we have about 220 million people. About 45% of the population lives in rural areas. Then the 2025 healthcare budget stands at $1.6 billion. Now, the budget is different from the actual funds released. So there is possibility that $1.6 billion is budgeted, and the government ends up releasing about $500 million. Then there are about 55,000 registered doctors catering to about 220 million people. Then half of the population is dimensionally poor, living on less than $2 daily. So without the subsidies from USAID, there is no way most of the people can afford the drugs. Nigeria's healthcare is going through one of the worst brain drains in history. Now, the next slide is going to explain the kind of brain drain we are battling with at the moment, and that is why we have about 55,000 doctors catering to about 200 million people. Now, about 3 years ago, I did a story about these two young doctors who founded a hospital in a rural community. Now, they died from complications arising from Lassa fever. Now, most of their colleagues learned their lessons from these two young guys. Most of them left the country to seek greener pasture. Now, let me continue with the statistics. And I'm going to give you a kind of health indexes that you need to know. Now, Nigeria has the highest burden of sickle cell disease in the world, with about 150,000 babies born annually with the disease. Then Nigeria has the highest malaria burden in the world. The country is among the top highest TB burden countries globally. Nigeria records one of the highest numbers of Lassa fever cases in the world. We've got one of the highest maternal mortality rates. And these are the things that most of the grants from USAID and Global Fund go into. Now, where's the money? Is it that Nigeria doesn't have enough money to cater to its 200 million people? Because Nigeria happens to be the most populated country in Africa. Nigeria is an oil-rich country, which you need to know. It is the largest oil producer in Africa, one of the top 10 countries globally in terms of proven oil reserves. While the country is chiefly, the attention is chiefly on crude oil, Nigeria makes money from agricultural exports. Our oil wealth is both a blessing and a curse. Again, where is the money? Let's start from massive corruption. Now, it's not that the money is not enough to take care of the people, but there's a lot of corruption going around, political leaders stealing money. Then we have mismanagement as well, then wrong priority. Leaders living very expensive lifestyle at the expense of the poor citizens. That's pre-Trump order. Now, most of the healthcare initiatives in Nigeria are donor-funded. USAID, the Global Fund. So practically, we do not have enough local counterpart funding. It's practically zero, or maybe about 10%. So we are totally reliant on USAID, Global Fund, and all that donors from Europe and other countries. Nearly all healthcare interventions in Nigeria are donor-funded, USAID. Then in 2023, Nigeria got about $600 million in healthcare grants. From 2022 to 2024, we reportedly got about $2.8 billion in USAID funds. Now, I'm going to give you this particular data. Now, if you look at it, you would realize that most of the healthcare initiatives, or most of the money coming for tuberculosis, actually come from foreign donors. Then, if you look at the last column, that tells you about the local funding. It's practically zero. Now, imagine when the money is no longer there. Now, we learned some lessons during the COVID era. So this is going to take much of my time because I did a story for Pulitzer Center about 2 years ago. It tells the story about a Nigerian state that won the war against COVID, but actually lost most of its children to meningitis. Now, during the COVID-19 period, the whole world was locked down. So there was no way we could get money from every other country. You know, if your house is on fire, there is no way you can attend to your neighbor whose house is on fire as well. You have to take care of your domestic issue before you attend to your neighbor. But during the COVID era, the whole world was locked down. So it was each man to its business. And at that particular moment, the Nigerian political elites came up with a lot of emergency funds. They created a lot of infectious diseases centers and were able to defeat COVID. Now, at that moment, Nigerians realized that COVID was an elitist disease, because it was killing more of rich people than poor people. But at the end of the day, we were able to defeat COVID. But what happened to meningitis? Meningitis, HIV/AIDS, malaria, polio, and other infectious diseases, we call them the poverty-stricken diseases because they mostly kill poor people. So the political elites felt there was no need to be somehow serious with diseases like this, unlike COVID. Now, what's the situation of things at the moment? We are practically sitting on a keg of gunpowder, it's a looming danger. Because we've got the highest burden of tuberculosis in Africa, and the funding is no longer coming. Case detection is getting low, so that means if we can trace most of these people that have tuberculosis, there's going to be like a kind of stronger infection within a short period of time. Then, let me move to the next slide. Now, this is where I'm actually going to. Now, imagine a world without a benevolent Trump. Now, I've given you a visual retrospection of the situation of things before Trump came up with its order. And now that the funds are no longer there, the situation is gloomy. So this is going to be the beginning of the discussion.
Thank you, Taiwo. He always gives an unvarnished view of things in his stories, which is good. We want to know the truth. Molly's going to talk about her reporting now and what she found in Africa. Maybe she can talk about, too, the interview with a former USAID person.
Okay, hello. Thank you so much for the introduction. And thank you, Taiwo, that was really interesting. And I'm going to give you a little bit of background on the series that I just did for the PBS NewsHour, supported by the Pulitzer Center, critical support from the Pulitzer Center. So as Susan mentioned, my background is a lot of global health reporting, and so when on January 20th, I believe, a day after he took office, President Trump made this decision by executive order to end basically all foreign aid. It was the biggest story, certainly, of my lifetime and my career, covering, again, a lot of global health programs, and a lot of times reporting alongside USAID staff in the field in very vulnerable, impoverished parts of the world. And so I think, immediately as journalists who cover any of these issues related to foreign aid, humanitarian aid, USAID did more than just health, obviously, we were kind of questioning, how do we cover this story? It's so huge. And we were hearing at the time a lot of experts in health predict some really staggering numbers in terms of how many people might lose their lives because of these cuts. And the projections were and still are very frightening and very large numbers. But as any journalist knows, if you just give people huge numbers and screaming headlines about the number of people who could die, it seems to kind of get lost in all of the news today, and there's so many important stories. So we decided to go out and find some communities that were really impacted by these cuts. How were they impacted? Most importantly, not debating the merits of foreign aid as sort of a macro story. I think a lot of people can agree that there are questions about how much a country should give to another, and the US was the #1 donor of foreign aid in the world before the Trump administration made these cuts. But what we wanted to look at specifically was the immediate impact of the cuts. And I say this because really important, I think, to this conversation is that we've just seen the beginning of this story. Because these are cuts to global health programs, we might not know for weeks or months or years, in some cases even a decade to come, what these cuts have meant for global health programs that have been built over decades, some of them very successfully. And so we went to look at the immediate impact of the cuts. We had information from our own government, from President Trump and Secretary of State Marco Rubio, stating very, very frequently that no lives had been lost due to the cuts to USAID. Marco Rubio, very specifically, Secretary of State, said, "No children will die on my watch." And those are the two statements that we took out into the field when we visited some communities that relied heavily on USAID to find out if this was true. You won't be surprised to hear that in our reporting, we found that many, many lives have been lost due to the cuts. And many of them have been children. I think there are some really excellent experts in health who are doing projections based on epidemiological modeling of how many lives will be lost, and those numbers are still staggering. So I would encourage everybody to, any issue that you're interested in terms of the healthcare space, to look into those numbers, because chances are that it will impact, global health is health. We're an interconnected world where disease can hop on a plane and start an epidemic anywhere. And so this story just took on this really global sense of importance and still is, and so we're seeing the tip of the iceberg. We went to 2 countries actually where the US has had, and working in tandem with other countries and in collaboration with global NGOs, huge health organizations worldwide, to have a lot of success in certain arenas. So in Ghana, we were looking at malaria and maternal health specifically. Both programs were funded heavily by USAID and had a lot of success. The maternal mortality rate in Ghana had gone down significantly in the past few years. The malaria eradication program, which was also a US presidential program, had also had huge success. And what we found when we spent some time on the ground visiting community clinics in the north of Ghana was that the medication wasn't getting to the clinics, the vaccines weren't getting to the clinics, the basic supplies that were needed for maternal health care, and certainly for critical maternal health care, postpartum hemorrhages, was not there anymore. We saw people being turned away at health clinics who said, I normally come here for my vaccines or for my life-saving malaria treatment, and they're saying there's no more. The chaos and confusion was sort of impossible to describe in many ways. The United States government, and again, the Secretary of State, said we will continue life-saving work, quote unquote life-saving work, and pledged to continue those programs. Again, what we found while we were in the field reporting from Ghana and then in East Africa and several parts of Kenya was that the administration is not continuing life-saving work. There are a couple problems with that statement. One is that in global health, the idea of life-saving is all of these programs are designed to save lives. They're designed to make communities better and healthier, and the end goal in a very impoverished community with all of these projects was to save lives. The other thing we saw was that in a lot of cases, specifically with PEPFAR, which is a very successful program started by Republican President Bush to end or to help the global war on AIDS, HIV, that people were, the US is still shipping the treatment, the ARVs, so we're getting the medication to a lot of countries, but because the administration has cut the whole ecosystem surrounding the delivery of that medication, they've essentially dismantled the program. And that was really disheartening to hear and see, and I think a story that really needs to be covered going forward. Everywhere in the world, honestly, I think this will have an impact. Any infectious disease, chronic disease, all of these things, again, it's a global health ecosystem now. We can't talk about health in any of our own countries without talking about global health. And just to close out, I wanted to just touch on a couple of the challenges that we faced in reporting this story. The first one was that the administration did not want this story to be told. How do I know that? I know that because when we reached out, I spent a month pre-reporting this story to USAID officials who had actually already been fired. They'd been terminated, and their lives had been upended, many of them living in countries, far, far away from home. Families there, they've uprooted to do this work, and their jobs were cut overnight with no warning, and the people's lives they were treating were in peril. They were in a very bad place. But in addition to that, they received an internal memo from the administration threatening them and intimidating them and saying that if anybody speaks to the media about the message that we're giving, which is this new America First foreign aid, and saying that anybody is dying because of it, there will be consequences. And that was a direct memo that we obtained that came from the administration to all USAID staffers. Again, even people who had already been terminated. So the chilling effect of that pressure from the administration is something that I think is important for everybody to be aware of because it has had a ripple effect because a lot of non-governmental organizations that were also providing foreign aid also began to feel very afraid that if they spoke to the media and told stories of lives that were lost, they might also lose their funding as a consequence. So it became a very difficult story to report. The one other thing I wanted to mention was the destruction of data, and hopefully we can talk a little bit about that today. But one of the first things that the administration did when they decided to shut down USAID was to destroy a lot of documents and databases. I noticed in the first couple of weeks when I was trying to report on the success of some of these programs in Ghana and Kenya that all the information had been deleted from the USAID website. And in fact, they just took the whole website offline. There have been people within the agency, sources we've developed, who have given us these reports. People were frantically printing out studies and research, decades of health information before it was effectively wiped from the internet. But that's something that I would encourage everybody going forward to keep an eye on, which is data, because this is going to have to be a global effort now to maintain that data. A lot of the Trump administration's cuts have been to jobs like epidemiology or the community workers who go out and collect the data from the communities for how many people have a virus or how many people are getting their medication. All of that has been cut. So we really, again, we're only beginning to see the impact of these cuts. The story is massive. And I think what I would say is just that now really what the world needs is a real razor-sharp focus on, there are journalists here from all around the world. How will it impact your community? Because it will. We saw in COVID, we've seen in other epidemics that these diseases can travel very quickly. They don't know borders. And the next one, is going to happen. And so how do you report on that? How do you keep an eye on it? How do you hold power to account? How do you maintain contact with people who are keeping accurate data now that, again, the Trump administration has cut so much research? And then I'll just end by saying that the one other thing that's been challenging is how do you report this story at a time when things are happening in your own country that are huge? And I was out reporting this story on USAID at a time when the administration also began dismantling the whole US public health system. And so that's another challenge that I think journalists really need to rise to right now, is knowing, again, that while there may be problems at home and it may be difficult to get a story reported halfway around the world about a really vulnerable, impoverished community, that story could become your country's story next week. And so it's really critical to view these stories as global and interconnected and as carrying a lot of importance, because USAID was, and these aid, the funding was going again to some of the most impoverished, neglected parts of the world. And those are places where these diseases, these next pandemics can explode. So, yeah.
Thank you, Molly. Great tips for people. It's definitely a global story, and it's just starting. I think this is a good time to point out that, in the United States, the American public, global health and USAID wasn't something people thought about constantly or even knew about. But I think reporting that's coming out, that's showing the devastation for what was a small investment out of all federal spending, is very polarizing now, and I think it weighs on the conscience of lots of Americans now. And they wonder, how can this ever be reversed in the future? What can we do? We shouldn't be withdrawing completely from world cooperation. Jeff, you can talk about ethics, please. You've looked into this with the coverage you've seen.
Yeah, thank you. Thanks for inviting me, first of all, I should say. And before I try to answer the ethics question, or maybe begin to answer the ethics question, I want to say a couple things. One, I'm not a journalist, I'm an academic. It's always dangerous to hand an academic a microphone and some slides, but I'll be as brief as I can. What isn't in my bio is I wrote a column for CNN.com, a bi-weekly column for 2 years in the early 2000s, so I have the utmost respect for people who write on deadline in particular, which academics are not so good at. The second thing I think is important to say is that you've heard about some of the dramatic impacts of the cuts to USAID in particular, and my university is not immune to that. We lost $800 million effectively overnight when the USAID cuts happened. Two very large programs at Johns Hopkins had to more or less shutter as a result. 3,000 people lost their jobs. I think all but 250 of those jobs were overseas. So there are, in addition to the kinds of health impacts that Taiwo and Molly outlined, there are real financial and life impacts on the people who worked in those areas. The third thing I want to say is, in my world, and certainly doing what I do at Johns Hopkins, where I'm a professor of bioethics, but also in the School of Public Health, we're used to the government coming to us to ask us for help when they're facing an ethics question in a program that they're trying to implement or a policy that they're considering. Generally, these are not self-inflicted problems, and so we're having, I think, a real challenge in trying to get our head around how to answer some of the questions. So I thought what I would do for my few minutes was just to point out some of the stories that I have seen reported so far that have an ethics focus from a global health perspective. These are certainly by no means meant to be an exhaustive collection, but just to give you a sense of the kinds of things that I'm thinking about, my colleagues are thinking about when it comes to ethical issues in the context of global health. You'll recognize, I'm sure, many of these. Two of them are headlines from the New York Times, as you can tell by the font. The upper left there was an early on in the aftermath of the decision to cut USAID funds that it was clearly understood that there were numerous clinical trials around the world where people were in the midst of sometimes having devices in their bodies being followed in the course of a clinical trial to treat a disease or an infection. And that had to stop literally immediately. And so people were left quite literally in the lurch with either, in the midst of a drug regimen or having a device inside of their body, and a question about whether that could even be removed, raising very serious ethics of research questions. Issues that we thought had been resolved a long time ago, frankly. Like, we didn't think there was ever a question about whether it was ethically acceptable to stop a clinical trial midstream and leave the people who were in it abandoned. So that's kind of an obvious answer. Lots of discussions by groups like Physicians for PHR that was focusing on access to healthcare, healthcare as a human right, equity, those kinds of questions, all of which, of course, are ethics. There was a large set of stories, actually, about contraceptives that are ready to be distributed, but decision made that they would not be distributed based on our current administration's views, and rather than give them or sell them to other countries that might distribute them, it was determined that they should be incinerated. So rather than making use of them or trying to recoup some of the cost, they were spending money to destroy them. So obvious kinds of ethics questions about the good stewardship of resources, the allocation of sometimes scarce resources, sort of the abandonment of individuals and countries and regions, all, of course, are ethical issues. So I have just one other slide, which is my attempt to try to capture. There's a lot of words on one slide, but it was my way of keeping it to two slides. Some of the stories that I think it's worth journalists covering this territory ought to consider. So that was part of my charge. So if the first slide is what I've seen, the second slide is what I think would be great for people to work on. Molly and I have started to have that conversation actually during one of the breaks. I'm happy to talk with any of you who are interested, either later today, or you see my contact information there at the bottom. So we can focus on everything from the micro to the macro. When babies are now being born infected with HIV in places where that has not been the case for months, if not years, which is a kind of clear ethics issue, and pointing to it what to be done about it seems kind of obvious, but pointing to it as an ethics question, not just as a human tragedy, but of course as both. And then, of course, the more macro kinds of issues of these kinds of decisions and their consequences, where we abandon not only individuals, but communities, countries, and whole parts of the world. What it means for both the US and the world that receive the resources from places like USAID. And I should say here too, research and the funding for it that developed therapies for HIV and eventually were distributed more widely through programs like PEPFAR, benefited the countries in which that research and the distribution of those drugs were made. But it also had very significant positive benefits to the US and the northern part of the world. So it's, I think, a mistake to focus on only the benefits that have been withdrawn, say, to the global south, when these, the findings of research, the benefits of the investment in these areas clearly accrued to the places where the investment happened directly, but also to places that made the investment. So I think it's sort of a wrong focus to say the benefits have only been withdrawn from the places where these funds were initially invested. There's a whole international order around how you do certain kinds of research in particular that is a violation when it's not followed. It's actually something that there are consequences and punishments for. I'm not quite sure what we would call what's happening in our country's behavior, but it's an abandonment of paying attention to those ethics-based regulations. It's an important and open question about what happens, not just in terms of our aid investment, but I presume, and so far it's been the case, that the pharmaceutical industry, for instance, based in the US, will continue to follow the international ethics-based order. There haven't so far been forced not to do that, but one can assume that that's a possibility. When we see the changes that are being wrought upon the world through these decisions, there's, I think, an open question about whose values are being represented. Typically, the USAID investments have been portrayed as gifts from or investment from the American people. But I think not all the American people believe that what is being done is in their interests or represents their views. And so that's a kind of ethics question. I think we've heard a little bit about soft power in the course of the forum the last day and a half. I'm trying to point out that soft power actually has some benefit. We're doing good things for other parts of the world, and when we stop doing that, that's a kind of moral failure, which I think deserves some attention. There has been an interesting, set of questions about, well, aren't there private donors, philanthropies that can step in and fill the void where the U.S. government has decided to withdraw? And I think we're understanding the scale by which parts of the U.S. government can invest and make change. Maybe it can be patched over for a year or two by large funders like the Gates Foundation or the Wellcome Trust or the Soros Foundation. There's a long-ish list of those, but they can't do that forever. And so, whose responsibility is it to try to step in when a government withdraws its support in these kinds of areas? All right, so that's just a very quick laundry list, much more to talk about, and I hope we'll have a chance to do that in the next few minutes. As I said, there's my email address. You all can find me very easily. Every high school student in the US finds me for some project they're working on, so I'm sure you'll be able to as well.
Of course. Thank you, Jeff. This is really good food for thought for a journalist to think about these tips that and questions that Jeff is posing. I'd like to ask you all a question, and then we can open it up to the audience to ask questions. We know that the consequences of cutting off USAID are going to be catastrophic in many places. It's going to be very difficult, plenty to be reported on to try to get the rest of the world engaged. But there are such serious goings on in the United States right now with things like vaccine policy, these complete reversals and challenges to good medicine and what doctors, our own doctors' associations are recommending in the United States. We have RFK Jr., Robert F. Kennedy Jr., as the health secretary, and he's a very strong vaccine skeptic. We've got President Bush out front urging mothers not to vaccinate babies with what are really life-saving vaccines. Earlier, Taiwo, we were all talking with Taiwo about vaccine hesitancy in Nigeria, which is already strong in many places prior to this, and that is the case in many places. Is this from the United States, these policy domestic changes, are they going to have a ripple effect in a lot of countries, your countries?
Yes, I need to start with when President Trump made the announcement. It was as though it wasn't real, but the president stood on business. So immediately the government started announcing some funds that they wanted to put in place to make sure that we wouldn't feel much of the impact. But the reality is the fact that, according to the slide that I showed, the situation at the moment is terrible. It's bad. Now, when that announcement was made, we knew we were going to sit on a time bomb. Now, at the moment, we've started seeing a kind of resurgence of HIV/AIDS. And you know, HIV/AIDS and tuberculosis, they are like husband and wife. They're moving together. So when there's a surge in HIV/AIDS, there's going to be a surge in tuberculosis and other infectious diseases. Now, we may not be feeling the effect at the moment because we've not really exhausted most of the drugs and interventions and some of the things that USAID put in place. But in a few months, we're going to see it. And that is definite.
If we're going to get data, right, we'll be able to see it. Jeff or Molly?
I think that's a great question. I think there's no doubt but that the U.S. administration's policy towards not just global health, but public health will be, frankly, detrimental in the sense that, you know, as Taiwo just spoke about, I mean, there's vaccine hesitancy in a lot of countries in the world. Also, it's a problem in the United States. So to have the President of the United States come out on television and say that these vaccines cause certain diseases, are not safe, has absolutely a ripple effect throughout the world and will only increase that vaccine hesitancy that so many global health workers and experts have been trying to combat for so long with all these community programs. One other thing is that in addition to the vaccine point, you know, the administration is also really waging sort of what a lot of scientists will say is an all-out war on science and research and facts. And I think that's made it really difficult, again, for journalists to cover what's happening. I think that the ripple effect of that is also huge because if you think about all of the expertise, the quiet, you know, scientists working away in labs to make really groundbreaking discoveries that help the health of the whole world, these are the people who help, you know, stem pandemics with epidemiological modeling, for example. And their jobs have been cut. They've been fired. Researchers in labs, war on cancer. All of this, for reasons I don't fully understand, but I'm working to, have been cut. And so it's like a self-inflicted wound. And when that's the message to the rest of the world, this devaluing of scientific fact, it will have a ripple effect. And I'm afraid that it won't be a very positive one.
Yeah, I think it can't help but have a negative ripple effect. I think we saw immediately after the press conference where Trump and RFK Jr. were talking about vaccines and Tylenol and autism, that press conference, that the UK public health leadership quickly announced, you know, ignore what you're hearing from the United States. That's a problem for anybody when you see, right, leaders of countries saying, you know, he's right, no, he's right, or he's wrong, no, he's wrong. I will say too, aside from hesitancy, it's just going to be harder to get vaccinated. I already had this experience. I went to get a COVID vaccine before traveling. I'm traveling a bunch, not just before this trip, because it wouldn't have been effective if I did it right before this trip. And I went to the pharmacy near my house with a prescription, knowing that I didn't qualify under the new criteria, and handed the prescription to the clerk, who asked me, why do you want a COVID vaccine? Yeah, challenged. I said, what do you mean, why? So why are you here? So I ended up getting one. I know how to navigate, but that's the kind of thing I think we're going to see much more of, and it's just going to be harder for people who want to get vaccinated, let alone people who are confused. So I think we're in for a pretty bad ride from a public health perspective.
I'm afraid so, and the point about Trump's press conference with RFK is really important. He also urged parents not to have infants vaccinated for hepatitis B until they're 12, because it's sexually transmitted, as if that's the only way, which it is not. We recently supported a project in San Francisco, a reporting project about a national effort to recruit more Asian Americans who have, as a demographic, a higher rate of hepatitis B into trials to test drugs for treatment and to also screen babies and make sure that they get vaccinated. They're all supposed to. But what kind of damage does it do to have the President of the United States urging them not to do that? So let's open it up to questions. Okay, how about right here?
Thank you for this very enlightening panel. I didn't know that much about USAID before your panel. I want to ask a sort of broader question. We can understand that the loss of USAID has obviously a global effect on so many countries who are depending on it, and also your own country, the United States. At the same time, I think it was 3 weeks ago where it was banned from Florida to have children vaccinated at an early age. So I guess my question is, what is the plan B for those countries who were depending on the United States to receive aid? Your own country was depending on your own country to receive aid. What do they do now? Because this is such a bleak announcement from a president who is going rogue at the Oval Office, and also a secretary who is obviously not qualified. He's not a doctor. So who makes the decision for a second plan?
Okay, I'm going to start from Nigeria, because we're quite dependent on the funds. Now, after the announcement, our government came up with certain announcements that they're going to pull up some funds to, let me say, bridge the gap of what has been left behind by USAID. But the thing is, as an investigative journalist, now, I have my distrust with the government. Now, if you didn't provide a counterpart fund when USAID was providing enough money, so how would you be able to provide enough money or provide the exact money that we need when the fund is no longer there? Now, the government has made a lot of announcements, political statements, and all that. But I know that they would probably wait until the situation becomes very bad till they come in. That was why I mentioned the fact that during the COVID-19 era, we learned a lot of lessons. Rich people came up with a lot of funds, millions of dollars. They set up a lot of emergency centers. They set up a lot of infectious disease centers, and were able to defeat COVID because it was seen as an elitist disease. So the political class and the wealthy class, they all came together, and they did something quite fantastic. And that also happened when we were battling with Ebola. We were able to defeat Ebola because it could kill the rich and the political class. So at the moment, I think the government is waiting for the time when things become really so bad, and that's when they'll come up with all the infectious disease centers and all that. Mind you, I need to add that all the things that they put together during the COVID-19 era, after COVID-19 left, we went back to our normal situation. The COVID-19 centers were all brought down. The money, they couldn't account for it. So I think at the moment they are waiting for that time bomb to tick till the last minute before the intervention comes. But I think the intervention will eventually come.
Thank you, Taiwo.
I mean, I guess I would just add to that by saying that it's so country specific. Every country has a certain amount of U.S. aid that they relied on previously. Some countries are going to be hit really hard, and we did hear in our reporting from a lot of governments that said, we're going to step up, we're going to fill the gap. I mean, what else are they going to say, of course? So part of it is just, political posturing. But I think, right, once a health emergency comes on, somebody has to step up and fill that gap. I do think I will say, I'm going to offer a positive thought here. Two things. One is that, I think it will be important to continue reporting on who fills those gaps now that the U.S. is gone. And I think it's important for two reasons. One, I think you can find stories of incredible human resilience in all of this. And I mean, certainly when I was out reporting this story, which was so bleak and there was so much death and suffering that it was pretty difficult, was to find stories of human resilience. Just briefly talk about one, which is in Kenya. We did a story on a USAID water project. They'd put in a water well. It was a very low-cost project that had massive, when you give a community of farmers in a drought-stricken area a well, the impact is massive, not just to health, but to economic stability, to that soft power, to keeping them safe, giving people jobs, et cetera. And when we arrived, this well has now been basically, it's kind of dismantled now because USAID is gone. But the local community had dug a trench to make their own pipeline. USAID had promised miles more piping, and it was in the works, and the pipes were coming, and people were so discouraged. But they did get shovels and build this trench of their own. So I think, finding those stories, you will find those stories if you report on this situation and how it's impacting communities of basic human resilience response to it. Because we don't know yet it's too soon to say what global NGO will fill these gaps, what they choose to fill, and how they'll make those decisions, I think.
Yeah, I would just add quickly, and also on a more positive note, just because the United States didn't see this as a good investment, or doesn't currently, doesn't mean other countries won't. There's clearly some, short-term pain and tragedy that result from a badly planned, overnight withdrawal. But it already feels like there are other countries that will see an opportunity where the U.S. has decided to withdraw. There was a story this morning, I think I read in Stat, that we're not funding mRNA research anymore in the U.S., at least for the moment, and a new mRNA research factory site is being set up outside of Oxford in the UK by Moderna. So I think you're going to see that kind of thing happening. It takes longer, obviously, for those kinds of things to happen than for an overnight decision to withdraw billions of dollars. So there's going to be a lot of short-term pain, but I'm optimistic that the world will figure out a way.
Another question, please? Let's see. What? Purple?
Thank you for this wonderful discussion here, very interesting. It's really horrifying what's happening. I was wondering, on the one hand, the Trump administration cuts the aid to foreign countries. It's also cutting funding for research within the US, and today was in the news they are planning to cut 53% of the budget for the US Centers for Disease Control and Prevention. So it is really absurd, and I would like to ask, what could be the end goal behind all that? Because they would definitely cause a public health crisis, even if it starts from outside the US. We see how the pandemic worked, for example. It's definitely going to affect everyone, everywhere. What is the end goal behind that? Because I don't believe they just wake up one day and they decide these absurd things. I think it's well planned. And what is the ethics behind this goal? Is it just to eliminate a big part of the world population for some reason, mainly the poor? But I mean, what do you think it is?
Did you all hear that?
I'm not. I'm
About getting this question.
We were.
Did others hear? What's the end-all goal? What's the?
Why?
What are they doing? Why?
Why are they doing it?
Why?
Well, this is the conversation that we were having, but I think we're all having. And somebody gave me some advice, which is don't try to provide rational reasons for people who are acting irrationally. So that's not a helpful answer, but that I think is a little bit of a way to get your head around it. I think we don't know what the end game is here, or the reason for it. And so we're trying very hard to manage. So I'm speaking now from my role as a university administrator and a leader of an institute and an academic. It's very hard. It's hard to plan when things are cut. It's harder to plan when you don't know how bad the cuts are. The uncertainty is really, really challenging for us. And it feels like a very self-inflicted wound that doesn't seem to have good reasoning behind it. It's not going to yield good outcomes. Why are we undermining this thing that's been kind of one of the best things about America and its biomedical research? It's really hard for us all, I think, to fathom this. On a little bit of a positive note, this is in the weeds, but it's somewhat an answer to your question. Very much in the details of how American civics works. We're entering into the time when we should have a new fiscal year budget in the United States. And both parts of our legislature, the House and the Senate, have indicated that they're not willing to cut the NIH by 40%, which is what the Trump administration has, demanded is the right term, but said they expect. And so it's a little glimmer of optimism that the Congress is actually saying no to the Trump administration about biomedical research cuts. We'll see what comes through. We're how many days away from when we're supposed to have a budget, end of this month, and it's not done yet, so it's obviously still a work in progress. But if that holds, at least there'll be a little bit of pushback against what seems like a really bad idea and, as you say, a self-inflicted harm.
For me, I think it's a really difficult question to answer. But without sounding entitled, I think it's an opportunity for African governments to sit up and to find solution internally. Because if we continue to talk about the end goal, we might come up with a lot of disinformation or with a lot of propaganda. So I do not want to, let me say, mislead people. But whatever it is the end goal is, only Trump knows, but I see it as an opportunity for African governments to sit up and proffer solutions to its internal issues.
Other question? Let's go. Anybody on this side? No? Okay. In green?
Thank you so much. Thank you so much for your presentation. I work for DevEx. We cover international development. I'm very familiar with a lot of your work. I had a question about our responsibility as journalists to frame this discussion, and specifically the Trump administration's point of view. I'm thinking about the title of this conference, which is Navigating the Age of Doubt. And, the Trump administration, when it comes to foreign aid, they, everything that they spend money on, they want it to be geared toward making America safer, stronger, and more prosperous. Those are the lines that we keep hearing. And, as journalists who might cover international development, we know, all of the ways that, investing in global health is better for everyone. So I just wonder how much credence we should give to the Trump administration's point of view, and should we frame things in terms of language and viewpoints that make sense to them? That would be my question for you.
Did you get that?
Yeah.
Okay.
I think I'm so glad someone asked this question because, again, as a journalist, we are trained to go out and approach every story from every point of view and to question our own, belief systems and values. And so just because, I was horrified that, children were not getting their HIV treatment in certain countries does not mean, that this is a horror story to other people, particularly in the United States where there's a lot of suffering, on all sorts of issues. So I think that the way our team kind of found a way around that, or still did our job, honoring that, fundamental promise as journalists, was to approach the story, again, not about the merits of foreign aid and whether the U.S. should be doing this or shouldn't. That is a very political discussion, and one that I think has a lot, there are a lot of things to debate. Was USAID doing everything right? No. Was all the money well spent? No, not in an organization that big. And I think those were very relevant questions to have. We wanted to look specifically at the way that it was done and whether or not the way it was done, the consequence of that were lives lost. So it was like a very specific thing. And we're hearing this from people in the fields, people who do this work, that people are dying unnecessarily, that we could have given these organizations an off-ramp, a plan. We could have said, you have a few months to end your program instead of doing it overnight, which was undeniably cruel. And so I think that's what you have to sort of, obviously we're human, and when you look at, I kind of liken it, and I'm not covered any wars or conflicts, and I have so much respect for those of you who have. I think it's kind of like when you're going into the field, though, and seeing people dying as a result of a decision that was made by your own government, it becomes really hard to have that objectivity. How are we going to frame it? What language are we going to use? And I was just talking to Susan about it. We're seeing it every day in our own media, struggling with how to frame, Tylenol is bad for pregnant women. Like, there's no evidence, certainly no credible body of evidence to back that, but I saw a lot of headlines that were kind of dancing around it and making it sort of seem to me like maybe there was some credibility, and I think that was an effort to sort of not look like you're taking one side or the other. And so I don't know if that answers your question. I think it's just, obviously we're human. If we're seeing human suffering and unnecessary deaths, we have to report it as such. But there are certainly questions within this broader story of foreign aid that deserve, another side of the argument and questioning as well.
Go ahead, Jeff.
I think it's really hard to show that public health works. This is just a feature of public health, right? Because it prevents bad things from happening. And so you invest a lot, and you say, well, what did we get for it? And and you could say we prevented the next pandemic, or we stopped an infectious disease from spreading. But it's not the same as curing cancer. And so this sort of notion that we don't need to invest in these things is kind of hard to do a story about. That said, feels like we should have learned something out of COVID, right? And that viruses don't respect borders. And here we are saying we're going to make America safer, stronger, by isolating ourselves. That just doesn't make any sense in the context of what we know about infectious disease and what we should have learned during the COVID pandemic. I think it's just a really hard story, and people are quite exhausted, frankly, right, about hearing about COVID and all the implications of COVID and what to do next time better. But that's the kind of work that I write. It's more in an academic environment and setting, but I think it's important if we can help communicate that in a way that would be interesting, to people who read the kinds of stuff that you guys produce. That would be a worthwhile thing for us to do better.
Thank you. Any other questions? Oh, we do. Okay. Oh.
Great, thanks so much. Yeah, I wanted to go back to the data question. So one of the programs that were cut was a demographic and health survey program that helped, I think, something like 90 countries get really critical health data. And I wanted to ask, so Taiwo, for example, in Nigeria, are you already seeing the impacts that lack of data is having? And Malmi, maybe you've seen that too in your reporting. So yeah, speaking about kind of filling those gaps, what are maybe some of the consequences of not having that critical data on everything from maternal mortality to HIV rates? Thanks.
Okay, if I got the question correctly, you're talking about the impact of the data that wasn't collected. I think while I was on the field for that particular story, for tuberculosis, we realized that immediately after the announcement was made, a lot of guys left the field because the money actually was going to contact tracers, a lot of community health workers. So they immediately left their communities. So they couldn't collect data that they needed. So at the moment, we are not sure of our HIV/AIDS data. We are not sure about tuberculosis. We're not sure about polio. So this data that are uncollected, I think it points to the fact that we are heading towards something quite disastrous. But at the moment, the guys working on data, the guys working in the community, all of them have been disengaged because of the effect of the funding cut. So I think this particular problem goes beyond the data alone. Everything is affected. And the manifestation will start showing up, let me say, in a few months.
Disengaged is a nice way of saying fired.
Yeah, I mean, I
let
think
go.
that my short answer would be yes, absolutely. And I think, again, our reporting was very specific, but I'll just give you an example of PEPFAR and HIV/AIDS. Like we were getting a lot of reports of clinics not knowing that their information has all disappeared. They have no way of tracking patients anymore. They have no way of knowing numbers of infected people in their communities. Those are some kind of scary data points to be missing from any kind of health project, especially, PEPFAR. So, yeah, short answer is yes. Yes.
Do we have time for one more question or not? Ending? Okay. Well, thank you so much for coming. Let's thank our speakers. And please, I ask you to visit the pulitzercenter.org website, where you can see lots of global health stories, some of these same issues explored. Thank you.